ma'am. So today I'm going to demonstrate how to mix both insulin or long-acting insulin and short-acting insulin in one syringe. So the first thing that we must do is check the medication order in the patient chart. Next, gather the equipment. So we have the alcohol, wet cotton balls, dry cotton balls, insulin syringe, and paper and pen for labeling. And also, we must prepare the insulin vial that are to be administered to the patient. So we have a clear insulin for the short acting and then the cloudy for the long acting. Next is check its expiration date. After that is wash hands and dry them. So we will use alcohol. After washing hands, remove the cup that protect in the rubber stopper of each vial. So the original, since we utilize only or we improvise our insulin vials, the original one has its own rubber cup and cup and rubber stopper. So let's assume that the cup is already removed for both vials. Next thing to do is roll the cloudy or the immediate acting insulin in between pumps for 10 times gently and make sure not shaking it vigorously. We can also do the sideways. After that, we must go to the syringe. So withdraw or draw the required amount of air which is equal sa required na dosage ng cloudy insulin sa patient. So let's say for the cloudy insulin, we have 10 units. So we withdraw 10 units of air. After withdrawing 10 units of air, held the cloudy insulin in the flat surface. After putting it, inject the air in the cloudy insulin vial. Make sure do not draw any insulin. And remove the syringe. Using the same syringe and needle, draw the required amount of air which is also equal, this time for the clear insulin. So let's say the required insulin or the required clear insulin for the patient is 20 units. So we must have 20 units of air. Same procedure, put it in the flat area or flat surface and then inject the air into the clear insulin vials. This time, we must keep the needle in this clear insulin vials. With the insulin syringe and needle attached, turn the clean insulin vial upside down. After that, with the needle bevel within the insulin, withdraw the required amount of clear insulin into the syringe. Make sure it is in eye level or vertically. So, sa clear insulin, since nag-inject or nag-insert ito sang 10 units of air or 20 units of air, we will also withdraw 20 units of insulin na. Make sure nga naka-eye level siya. 20 units. After withdrawing 20 units, turn the vial over and remove the needle from the vial. Check if there is any bubbles. Next, insert the same syringe, this time in a cloudy insulin. So since we inserted before 10 units, again, since we inserted 10 units of air before, so it is also equal to the insulin that we must withdraw from the vial, which is also 10 units. Upside down, eye level, and vertically. 10 units. Turn the vial over and then remove the syringe. So carefully recap the needle. So we must perform, or we can also use the scooping method to prevent contamination. Recap, close the cap. Again, check the medication. So before, we have 10 units of cloudy and 20 units of clear. A total of 30 units. Make sure that the insulin in the syringe is 30 units. So next thing to do is label the medication. Label the medication, the date and time it is open. So today is 03/30/2022. Per vote vials. So store the vials containing the remaining insulin according to the medication stored temperature guidelines or according to the agency policy. Next is perform hand hygiene and proceed to the administration based on the prescribed route of the medication. That would be all, ma'am. Thank you.